So provinces across Canada are starting to reopen their economies, but the threat of COVID-19 is not behind us by a long shot, especially in provinces like Quebec and Ontario and Alberta that are still seeing hundreds of new coronavirus cases every day, especially in long-term care homes. This is provincial responsibility, of course, but what should the federal government do about it? And what about the newly reopened meat processing plant in Alberta that saw over 900 workers, 900, test positive for the virus? Is it safe for them to return to work there? Let's find out. NDP Leader Jagmeet Singh joins us now. Hope you and the family are well, Mr. Singh.
Thank you.
Let's just start with Alberta. Do you think it was wrong for Alberta to let the meat packing plant in Cargill reopen after those high infection rates?
Yes. And it's particularly wrong because of three things that are missing. Well, two things in this case that are missing. First off, we need to know workers are safe. Before workers return to work, they need to know that they're going to a place where they're not going to risk getting infected or infecting their colleagues. And there were some really clear requests about space and distance and ensuring that the work conditions are such that the workers are not going to infect one another. And then secondly, we need paid sick leave. A worker who gets sick needs to know that they don't have to choose between going to work and risking spreading an infection or staying at home and not having paid sick leave and not knowing how they're going to pay the bills. So those are two things I think that need to be in place before, particularly in the case of Cargill, that work resumes. But in general, the third thing would be childcare. A lot of parents are worried about childcare, not having access to it, and particularly that a lot of women were let go from work because of the service sectors that were impacted. So women have been disproportionately impacted. We need to know that there's good quality childcare available.
Okay, well, there's the meat packaging industry and the meat processing, but there's also long-term care, and COVID has revealed those long-standing weaknesses in long-term care homes. 80% of the deaths have been in long-term care homes. This has really exposed, frankly, a failure of the provinces. We've got 1,600 members of the military now there. What needs to happen now? Should these be, a lot of them are private, by the way, should these be federally regulated?
Well, we need to make it really clear that the painful evidence of the neglect of our healthcare system is the fact that our long-term care homes are seeing such high numbers of deaths. And what we need to do is we need to make sure that there's a national care guarantee. If your loved ones are going to a long-term care home, people need to know that they're going to be cared for, that they're going to be safe. And right now, the for-profit or the privatized long-term care homes are the site of some of the worst conditions and the highest numbers of deaths. So we absolutely need to look at developing a national standard, a care guarantee, and then using the Canada Health Act to bring that into the public realm. It's got to be public and it's got to be high quality.
It's got to be public. Okay, so that's interesting. Would you call for two things? Would you call for a ban of private long-term care facilities?
I think we need to end them. I think there's no question about it. Given the results that we're seeing, the evidence that we're seeing that some of the worst conditions that seniors are in and some of the highest deaths have happened in the for-profit long-term care homes, there's really clear evidence that it's the wrong way to go. Profit should not be the motive when it comes to how we care for our seniors. They need quality care. They need high quality, safe conditions. And the for-profit system has failed, and long-term care homes in general have failed seniors, and we need to do a lot better.
To be fair, public ones have not done very well.
Right.
So who would pay for that? Do you think the federal government should have strings attached on the Canada Health transfer? We'll give you the money, but it's got to go to long-term care homes. Is that it?
Well, we've suggested, and we campaigned on this in the campaign, that we should look at national standards, so a care guarantee nationally, and then work to roll in long-term care home into the Canada Health Act. So there are those accountability measures, and absolutely the way our Canada Health Act works is the transfers are based on a number of principles about quality, about accessibility, about it being publicly delivered. And similarly, we could bring those same criteria to long-term care homes as well.
Elizabeth May was just on our program. She said oil is dead. The Bloc Québécois leader said we should not be supporting the oil industry in this crisis. Do you agree with Elizabeth May that oil is dead?
Well, I don't think it helps to make inflammatory comments. I think the reality is there's a lot of workers in the resource sector and a lot of workers in the energy sector that are really worried about their future. And they deserve having long-term jobs, and Alberta needs a lot of help. And I know the future of energy is renewable energy. I know the future for how we build up our infrastructure has to be one where we're taking into consideration our emissions and reducing those. But for those workers in the resource sector, those workers in the oil sector, it's none of their fault that they're going through this crisis, and we need to make sure they get supports and help. I
So
want to bring them along.
you think more aid should go to the energy sector?
Well, I don't think any aid should go to any sector unless it's tied directly to workers. And I also think there should be a second criteria of long-lasting jobs. We need to make investments that create long-term opportunities for workers. And that's going to be my criteria. Additionally, long-term sustainability means making sure we're working within the confines of our environment, and we're working in a way that is in line with that. So there's ways to do that, but I don't want to turn my back on any worker, and I want to do it in a way that brings these workers along.
Finally, 2 million jobs were lost in April, another million back in March. We're clearly in a recession. If you calculate actually wider, people who have jobs but aren't getting paid, people that aren't looking, the unemployment rate could be from between 13 and 30%, depending on how you calculate. Would you like to see the government transform the Canadian Emergency Response Benefit, which gives over 7 million Canadians right now $2,000 a month, into something longer term, extended, maybe even into what you've talked about before, a universal basic income?
Short answer, yes, we need to look at long-term benefits for people, and we need to review the EI system. The EI system was designed in the 70s and is not sufficient to respond to the needs of people. We saw that under the EI, only 40% of Canadians would even qualify. So we need something much broader. And whether it's the CERB modified to be a long-term tool to give people the help they need, or another program, we absolutely need to look at a better way to take care of one another and a better social safety net. Absolutely.
All right, I got to leave it there. Jagmeet Singh, I appreciate it. Thank you so much on Mother's Day joining us. Appreciate it.
Thanks so much.
Coming